Hello, it's me again, Selby Nimira from One Lesson. So now I will going to perform an oral care for my unconscious patient. It is very necessary to do every day, at least every day, in order to help them to clean their mouth and also to prevent some possible infection for oral cavity, and of course to avoid heliotis or the bad breath, and also to prevent any possible complication in their oral cavity. So, good day, Ma'am Myra. I'm Selvina Mira, and I will going to help you to do your oral care, and um, just lay down here and relax. So, so even this is unconscious clients, you should always remember that you need to talk to them in order to aware them for your procedure, and also even they unconscious, they also heard us and feel what happenings around. So before that, here's our equipment we will going to need in this procedure. First is towel, in order to avoid wetting of their clothes and their bed. Next is kidney basin. We will going to put there all our waste on the procedure. Next is our disposable pad, in order to cover the surface and also to avoid splashing any liquid and maintain dry the area. Next is our 2 glass of water. The first glass is we're going to use it to mix our Colgate in order to clean our patient mouth, and the next is our second glass, which is the one we need to rinse our patient mouth. Next is we will going to need cotton applicator as a alternative toothbrush, because since our patient is unconscious, she didn't applicable to use toothbrush in order to prevent or avoid any problems such as wounds or sores or anything possible complication by using toothbrush for our unconscious patient. Next is our padded gauze that help us to guide, open our patient mouth, and guide is to show the inside of their full oral cavity. We will using this light. And the last is our lubricant in order to maintain our unconscious patient or her mouth to maintain it soft, moistened, and clean. So now, Ma'am Myra, I will going to wash my hands and put the gloves in order to help you to our procedure, and in order to avoid cross-contamination of microorganisms. So I'm going to wear my mask or my PPE, and we will start for the procedure. Now I already wear my gloves, and the next thing we will do is to place our clients on her 45-degree position, which is I already done. And next is to put the towel on the side of our clients in order to keep dry and avoid wetting of her clothes. Next is we're going to turn her her head in the side gently because this is an unconscious client. And now we will going to prepare all the equipments and the area to proceed to our procedure. Now, before we going to proceed, I will going to put the disposable pad in order to help our surrounding cleans and avoid splashing of liquid. Next is I will going to put toothpaste. The toothpaste which is prescribed by our client's doctor. So we will going to use it as a cleaner for her mouth. I'm gonna put a little amount of toothpaste and I'm gonna mix it. And now we were gonna use a cotton applicator as I said lately. It is an alternative toothbrush for our unconscious patient. We will going to use the first cotton and put it on the water that has a toothpaste, and make sure that before you put it on our client's mouth, you should ensure that there has no excess of water to avoid aspiration for our client. So the first cotton, we will going to clean the upper and lower of our client teeth. So we will going to talk to her if she can open her mouth even she is unconscious. Uma, will you open your mouth? But if she didn't respond, we're going to use this padded gauze to guide to open our client mouth, but we will going to use it gently in order not to distract our clients or avoid any problems. So we will going to open gently our unconscious client mouth. And we will going to clean the upper and lower of her teeth. Next, the lower of her teeth. Okay. After that, the waste is we're going to put in the kidney basin. And next, we're going to use the second cotton applicator and put it on the water that has toothpaste, and also make sure again that there is no excess of water to avoid aspiration. And we will going to clean our client mouth of her inner and outer teeth, tongue, and gums. So we will going to use again this padded gauze to open her and gently open this. Okay, now will you open? Okay, I will going to put it in the kidney basin. And now I will going to use the last cotton to rinse her mouth by the water. I will going to put it on the second glass of water, or it is a clean water, or a clean tap water, because we need to use a clean tap water in order to avoid any problems or any possible problems in that can cause of cold water or not clean water. So now I make sure that there's no excess water before I'm gonna rinse my client's mouth. So I'm gonna rinse it now. Oops, I'm gonna use this. I'm gonna use another another cotton applicator in order to rinse well my client mouth. I put it again in the clean water and gently rinse my client mouth. Okay, so I'm done cleaning her mouth, and next is I will going to put lubricant or any moisturizer agent to prevent soft and moist hair dip. But before that, I'm gonna wipe his mouth if any excess water on her mouth. And I'm gonna put this lip balm or agent, moisturizer agent, but I'm gonna use it gently because this is an unconscious patient. So next thing is we're going to clean the area and arrange it again from its previous arrangement. I'm gonna get it this towel and I'm gonna clean the area in order to prevent any hazardous situation. I'm gonna discharge all the waste I've used in this activity. And collect all my equipment. It is very necessary to ensure the surroundings clean in order to help my clients to prevent any possible microorganism. And after all cleaning the area, after all discharging all the waste, I'm gonna remove properly my gloves. And discharge it on the proper trash can. So the last thing I will do is to record and document all things happens on this activity. So now I'm done discharging all the waste and record all things happens, and I already place it again on her proper positions, and I ensure that the environment or the surroundings is clean. So I'm done doing oral care for my unconscious patients. So that's all, Ma'am Myra. Thank you for today, and may you get well soon, and may you have a good day. So